Okay, let's talk about our patient today.
Our patient today is a dentist.
Young lady, a preeminent lecturer,
A dental hygienist
from Bulgaria,
Buffalo, New York.
Atlanta, Oklahoma, Vancouver, Canada, Boston, Kansas City, San Francisco, Montreal, Munich, Germany, London, and Santa Maria, California. And we're going to place 14 Lumineers,
8 Lumineers,
10 Lumineers,
6 Lumineers,
10, 2, 8, 8, 10, 10, 8, 10, 8 Lumineers today on our patient.
and now we're not treating teeth anymore. We're treating smiles.
Isn't that beautiful? So let's look at the transformation from where we started and where we are. Our patient today is an example of that. We're going to do a live placement of Lumineers today. We're going to place 8 porcelain veneers on this patient. No grinding on your teeth and no injections. And we took an impression. Yep. We did try them in and select a shade. Okay. And to save time today, we won't go through a lot of that process. We normally do that in the 2-day program where you can let the patient choose a difference in shades. I never like to let patients look at Lumineers on the try-in because they never look as good as they're going to look when they get finished. And the nice thing about Lumineers, if they're not satisfied, you can take them off and start over. You and the patient aren't happy. But before we get started, we're going to do this in about a period of an hour, including the first finishing. So Lisa has put everything on this tray, and it's all set to go. So before you do your first case, you and your staff want to review a DVD a couple of times together. Lisa has done, she's put porcelain conditioner on the porcelain veneer. She's put the silene on. She's polished his teeth with porcelain polishing paste because that has an enzyme in there to help get rid of the plaque on the tooth. So when we go to etch it and do surface treatment, we'll get a much more exposed surface than having, because plaque is really grease if you think about it. And then it'll give a better opportunity to prepare that surface. Okay, we're going to use the Sapphire Light to place these in about less than 1 minute. 8 porcelain veneers. Okay, then we're going to finish them, and we're going to use 4-power magnification so that when you're working without local anesthetic, you don't touch sensitive tooth structure. Now, in order to do this and get a good result, you're going to have to use a good impression. And so we recommend the Lumineers impression material, get sharp feather edges, we don't retract the tissue, and you should really pour a model before you dismiss your patient because you want to check those margins to be sure you're satisfied with them. All too often when they come into the laboratory, sometimes there will be a margin that's faded out and it's not visible. We have to call the dentist and tell them that you need to take another impression. Sometimes they'll fit the model perfectly, but not the teeth. What caused that? Took the impression material out too soon. So here we go. And Lisa's going to put the lip retractor in. And then I'm going to take some Paynon Dental Dam and place it on the lingual side of these teeth. And you'll see why that's important in just a moment. Open. Now, there's a little diastema in here, so I have to be careful that this Paynon Dental Dam doesn't go through to the labial side and prevent seeding of these Lumineers. And this is the same Paynon Dental Dam you use to isolate teeth when you're bleaching. Close. Open. We take a 3-second exposure, Sapphire Light, and polymerize it to a rubbery state. And then we'll go to the other side and get that done. Close your eyes. The best way to protect your eyes is to close them. And this is what it looks like on the lingual side. So wherever we have that Paynon Dental Dam, we won't have the Ultrabond attaching to the tooth, so it facilitates cleanup really easy. It's all reversible, and I'm taking the Etch N Seal, which is 35% phosphoric acid with aluminum oxalate, and putting that on the teeth to etch the enamel. And if you're using the aluminum oxalate, the Etch N Seal, and you're working on an operative patient, the aluminum oxalate helps seal the dental tubules. Now we've removed the surface of the enamel, 10-15 microns, and we're going to put Tenure on. And we put it in a dappen dish, and it doesn't require a light to cause it to polymerize. We've been doing these for over 20 years. Now I'm going to put Tenure S on these teeth, and the purpose of the Tenure S is to protect the prepared surface from contamination. If we were doing a try-in with the Ultrabond try-in paste, which is still the same as Ultrabond without the activator in it, if we inadvertently don't get it all out of the luminaire when we try it on, then the Tenure S will polymerize it. Okay. And we're using Supreme White here today, and as I said on a prior visit yesterday, or the day before, right lateral? Okay. Right cuspid? And the right first bicuspid. We had already determined this was going to be the shade for him. What I'm going to do on this right side before I go over the left side is spot cure the luminaire in place for 1 second, and that'll keep it from floating around. So I gently place this, and I see excess escaping everywhere. Close your eyes. And the reason I do this is so if you see excess, you know you've got enough. And so I just gently put it down, gently place it on there, see a little excess ooze out. Close your eyes. And close your eyes. Now we go to the left side and place these, left lateral. Okay. And you need to have everything dry, gently in place. And we always stay 1 tooth distal to where we're spot curing. And the reason is we don't want to inadvertently cure the resin on the contact point. Close your eyes. Close your eyes. Close your eyes. Okay. And we take off most of the excess. And some of this has already started to set with the Tenure S, even before we got a lot of light to it. And then now we'll take the 9mm tip and cure each tooth for 5 seconds. 8 teeth, 5 seconds, 40 seconds to set 8 porcelain veneers. Close your eyes. Close your eyes. He's got it, it's fogging. Close your eyes. Close your eyes. Close your eyes. And close your eyes. Now we'll take a look at what this looks like on the lingual side. So now we'll take off the paint on dental dam. Now everybody gets a quick look on the lingual side here. And see how easy it is to clean up that lingual side? Now we're going to go in with a football-shaped diamond. And we're going to blend the lingual side with the labial side. Can we get that? And this is a picture of the football-shaped diamond. They're all in the Clinician's Finishing Kit. And I just blend the Ultra Bond and the porcelain together. And I don't discriminate between porcelain, Ultra Bond, and enamel. I just remove anything that is unaesthetic or doesn't fit into the contours just exactly the way I want them to. Now some people say, well, why don't you try to finish before you set the resin? So then I raise the question, what's the objective? The objective is to get a stress-resistant, non-micro-leaking aesthetic restoration. Now we'll take the long, narrow diamond and define these lingual embrasures. And I will just go on the lingual side. With 4-power magnification, I am approximately 15 inches from the patient's teeth, physically. But visually, I'm about 3 inches. And that gives you a much better ability to discriminate between tooth structure and non-sensitive tooth structure. We never retract tissue when we take the impression. And I just define these lingual embrasures. It's very important when you want to open the contacts, because remember, they're all fused together now. I'm using a 349 instrument here. It's used by orthodontists for seating bands and removing them. And the reason I use it is I can apply a lot of force without scratching the porcelain. Never use a hygienist scaling instrument on glazed porcelain or you'll scratch it. Now we're going to the labial side. It's so easy to visually discriminate between sensitive tooth structure and non-sensitive tooth structure. And I'm just opening up these embrasures, staying away from the labial surface so I don't remove the glaze. Turn it this way just a bit. And what we do on the first visit is we do about 80% of the finishing. Now we're just taking the Schure 349 and removing the Ultra Bond that's bonded to that glazed Cerinate porcelain. And as I said, no matter how hard you press on this, you won't scratch the glazed porcelain surface. And by making sure we have excess around all of the margins before we set it. We never have micro leakage occur under the porcelain veneer. What I'd like to do now is have you take a look at the difference between the preliminary finishing on the left side compared to no finishing on the right side. So you can see how those embrasures are defined. We kept a little bit of that diastem in there. See how they're all filled in? So when you try to show your patients what things are going to look like with lumineers, they don't look like they're going to look like after they get finished. And we're blending the Ultrabond and the porcelain and the tooth all together, so it'll have a indistinguishable margin transition between that with an Explorer. The other nice thing about it is you can contour these veneers after they've been bonded. So you can make the emergence profile be exactly what you want it to be afterwards. One of the most important things you have to remember is occlusion. Because if you have occlusal prematurities or eccentric prematurities, that will cause fracturing of your veneers. You've probably already experienced that with your porcelain fused to metal crowns. Now I'll give you a quick look here at the change. Let's look at the transformation in a smile from where we started and where we are. That's before. That's less than an hour ago. And we're just about 80% finished. Now the next thing we're going to do is we're going to adjust the occlusion. Secret to occlusion is going to make sure the patients are in centric and harmonious eccentric. Put your chin down. Now look at that aesthetics. This is run-of-the-mill. I don't get pick of the litter. I send it in, and this is what's done for me or done for you. And if you want something different than that, I usually just give the instructions to the studio to give them a shade. I usually take shade B0, B1, 50% translucency, and I ask them to make it look nice, and this is what they give me. And if it doesn't look nice enough, I send it back, and they make it look nicer. Yeah, do it again. Grind your teeth around now. Forward and back sideways. Open. Let's take a look at what his occlusion looks like here. You see this mark right here on this lateral? That's asking you to knock off the distal of that porcelain. Let's take a look over here at the cuspid. That's asking to get that knocked off too. Oh, look at this mandibular cuspid right here. Right there. Doesn't look like a heavy mark, but that's wanting to knock off that lateral. So no matter how much you know about occlusion, if you don't apply it on the installation, you can miss something and then have the patient get a little fracture. So we're going to relieve those now with the football-shaped diamond. And we want to get these inclined planes removed so we have points of contact. And one of the things that's gone over rather extensively in the 2-day programs is how to accommodate occlusion so that you don't get fractures after the installation. Okay. Marking paper. Close. Grind around. Open. Now let's see what we have here. A little heavy on these lower anteriors. Let's see what it looks like back here. Oh boy, look at that. If I let him go home this way, he would break off this incisal edge. And we'd have trouble with the distal of this cuspid. And we got to look out for these areas right in here. The secret is to get your patients into centric and then into a harmonious disclusion. That's the key. If you have to put a patient in a night guard, you haven't established a harmonious occlusion. And now we'll take the CeriSaw and open the contacts. So you just take the CeriSaw and go through there because we've removed all of the Ultrabond. And I don't always get to open all the contacts on the same visit where I do the placement. If it gets a little tight in there, today we're getting almost all the contacts open. Usually the bicuspids are the ones I do on a follow-up visit. Now we take the CeriSander, which is an orthodontic diamond-impregnated stainless steel band. Orthodontists use this a lot to open embrasures and change dimensions of teeth. And what we don't get finished today, we do on a follow-up appointment a week later. And the reason is that when the patient's been sitting in the chair about an hour, they think that's a long time. They don't know how long it normally takes for doing 6 or 8 veneers. Now we'll take the floss and I'll show you how to open them. And then you can see going through. And go down. There we go. So, we have spent less than an hour. We placed 8 veneers, and the only reason this is a very simple, straightforward case. If it was a more complicated case, we could be bonding porcelain to porcelain, just like we could bond porcelain to enamel. You can do that. Most dentists don't realize they can take clinically acceptable, satisfactory bridges that don't match the rest of their teeth, and they can bond lumineers over that and extend the life of that bridge. Now we're going to let the patient take a look at this. Huh? You got to say that real loud so they can hear that in the mic. It's amazing. Big smile. Here, right, okay. Put your chin down a little bit. That's good. And so we're about 90% finished. We've opened the contacts. We've established occlusion. We've bonded 8 porcelain veneers on somebody who didn't need anything but wanted something. So this is where you get to significantly expand the treatment modalities in your practice. I'd like to welcome you to come out here to Santa Maria to visit us, take the over-the-shoulder course. So I'm going to wish you goodbye and good luck, and give us a call or stop by and visit us whenever you get on this area. Okay. Goodbye.
Well, my name is Dennis Cordeniz, and I have always admired people with really nice teeth and that kind of thing. And my teeth weren't really bad, but I thought I was a candidate for nicer teeth. And so I had heard of this product, and it is just, it basically will change your life. It's just fantastic. Unlike the regular veneers where they have to grind and cut and that kind of thing, these are just basically like they advertise, a contact lens that goes right over the top of your tooth. So you really don't feel anything other than just the tools and a little bit of pressure. No anesthetic was used whatsoever. It was absolutely painless. It was just perfect. To go out and get the conventional implants or veneers would not be an option for me. I would have just stayed with what I had. But now that this product is available, I encourage anybody that is even considering to have this done. It's incredible. I get asked all the time now, there's something different about you. What is it? And they can't put a pinpoint on it, but what's really cool is, I don't mind telling them I had this procedure done, and they go, whoa, that's amazing. And how can I have that? It's very, very cool.